Hi, I'm Amy Yee, and welcome back to Wired for Change, where we turn bold ideas into practical progress. Today, we're exploring how technology is reshaping the mental health care landscape in Canada. We'll look at what's working right now and what we need to get right as digital tools and AI become a bigger part of the care experience. Today, I'm joined by Maureen Abbott, who is the Director of Innovation at the Mental Health Commission of Canada. Maureen and her team are advancing e-mental health from evidence-informed digital tools and stepped care models to new guidance for trust, safety, and ethical AI. At a time when timeliness and culturally relevant support matters more than ever, we're going to talk about how to scale innovation in Canada in a way that includes everyone and look at how to build a future of care that Canadians can truly trust. Maureen, welcome to the show.
Thank you for having me, Amy.
I'm so excited to have you here. We first met back at Accreditation Canada, and I
Right.
followed your work ever since. And I'm so excited to see where you're at and the
Thank
important work
you.
that you're doing.
Thank you. Same.
So let's start with building the foundation for folks who are newer to the idea of e-mental health. It's something that's moving so quickly, and there are lots of digital tools out there, but it might be confusing as to who owns what or what guardrails exist today.
Mhm.
Maybe you could start by just defining a little bit more about what e-mental health is and what the role of the Mental Health Commission of Canada is.
Yes, absolutely. So we'll start off with e-mental health. We have a broad definition of e-mental health. So we're not only talking about text reminders for appointments, apps, artificial intelligence, but right through to virtual reality, some complex and persistent technologies that are used to look at severe mental health issues as well. So it's very much a range. It's really any types of technology that uses e-mental health supports or enhances mental health supports. And it can be used for kind of wellness, so mental health wellness and more less severe mental health issues. Or, like I said, it can be used right up until, suicidal ideation and more severe and complex issues as well. And it can be used in tandem with in-person care, or it can also be used on its own. But we always try to emphasize having that flexibility with care. So we having those choices, whether it's an e-mental health service or it's an in-person service, letting people choose what works best for them. And then at the Mental Health Commission of Canada, so the commission has been around since about 2007,
Mhm.
and we are a not-for-profit, a charitable organization, and we have most of our funding from Health Canada, but we also work individually with some provinces and territories and individual organizations. And we are there to really support best practices, provide resources, policy, and we work mostly at the national level, but we also work individually at the same time with provinces, territories, jurisdictions, organizations, and communities as well to really improve mental health services across Canada. And then my e-mental health team that I work on,
Mhm.
and it's under the broad range of innovation. So we work on policy and research with new and emerging trends in mental health. We have our lived experience councils, our hallway group, and our youth council as well on the team. And then we also have our e-mental health file. So that includes what I'll talk about today. We're doing work on mental health app assessment. We're doing work on artificial intelligence, and we have an e-mental health strategy for Canada.
So, given everything that we're discussing, I mean, the stakes of e-mental health are about, access and innovation, but also about safety and governance, and trust, of course. And so, maybe you could tell us a little bit more about the e-mental health strategy that Canada has put out and you've put out.
Yes, absolutely. So the e-mental health strategy for Canada was launched in 2024 at the e-mental health International Congress. And this document is a guiding star document for future directions in e-mental health in Canada. And there was really a call from health leaders across Canada, practitioners, those working in the field, and those with lived experience, to really understand what are the future directions that we need to work on and that we need to look at for e-mental health in Canada. So the document outlines 6 priority areas and 12 recommendations for e-mental health and next steps in Canada. And as we were developing this document over the course of about 2 years, we worked with Mental Health Research Canada to develop this document, and we also had half of the advisory committee with for those with lived and living experience. So we really had a large input from those end users to be able to understand, what are the key priorities for e-mental health in Canada. And some of the priorities that were named were around in the importance of equity, diversity, and inclusion. Also, making sure that barriers have been identified and improving barriers for e-mental health. So, thinking about remote access, Canada is a diverse nation, and we have so many populations that do not have internet access. A lot of these populations are also Indigenous communities that are in remote areas that cannot access electronics and the internet. So, thinking about those barriers, also interoperability. So, the e-mental health, it's not only a mental health and substance use issue, but this also relates to how we connect to the overall health field. In most cases, the primary care physician is folks' primary contact with a mental health resource. So, how does this connect broader to the larger system? Also looking at trust. So you mentioned trust, and we did identify that as a barrier as well. So, we know that people are using AI tools, they're finding them effective and e-mental health tools, but they lack trust in these tools. So, what are ways that we can make sure that these tools are safe, quality, and effective so that people feel more confident in using them?
Amazing. Thank you.
Sure.
Really important work, and I know that's available on your website, as well.
Yes.
And then when will it be revisited next as things change so quickly, in the environment?
Yes, so the e-mental health and technology field, it's constantly changing. So we are looking at what that cycle will be. Right now, we're just in the middle of being able to disseminate these priorities and recommendations. So it might be a few years down the line that we
Mhm,
decide to update this.
mhm,
But at this point, we're really looking to make sure that people have access to this document. Some people are even using this for funding resources. They're pointing in this direction that this is an important priority that we should be working on,
mhm.
and really having it as a guiding star for health leaders in Canada.
Makes sense. Thank you.
Sure.
Yeah, when I talk about risk, I often think about in terms of, just like it's got exponential potential to have impact, right? But it also has, exponentially kind of scaled risk, as well. And as you alluded to, there have been some tragic cases just this year where, unfortunately, interaction with ChatGPT and other AI, has, resulted in some deaths. Um, Let's talk a little bit about, what your approach is for kind of tackling that in terms of the safety side of things. Because as you said, there are a lot of apps being built. It makes sense to try to help. A lot of people want to help.
Yes.
And there are some big, companies out there that are trying to do the right things, and are saying that they're doing the right things. What's your approach for looking at that? How should people sort of think about it?
Yes, and I think the stories that you're referring to are really along the lines of where chatbots have led people to really tragic ends, sometimes resulting in suicide.
And
And
as a parent, like, how is that like, how terrifying is that? I mean,
it,
you and I are both parents. I think it
yeah.
really gets to the heart of, what's possible that we wanna prevent.
It really breaks my heart.
Yeah.
It's hard to even finish reading some of these stories that come across my desk, and I can't imagine as a parent having to, look through these logs from these chatbots on, how their children were interacting with these chatbots. And children are so intelligent that they know ways to be able to get around the system and be able to find out the answers that they're looking for. And the Mental Health Commission of Canada developed a chat safe resource for children and youth. So I really encourage parents children and youth to really look and interact with this resource. And it's really focused on directing children and youth to be able to understand when you're having these really difficult conversations around suicide or suicidal ideation, there are great resources out there and in-person services as well that people can access and receive support and really move on, with their lives as well, with these the support and resources. But we also need safeguards, which is something that in Canada, we don't have safeguards for artificial intelligence at the moment for mental health and substance use health. And this is something that we're working on with the Canadian Centre on Substance Use and Addictions. And we're developing artificial intelligence guidance for these two fields because even though we have some guidance at the federal level, we have guidance at the healthcare level, we don't have anything at the moment for the specific needs for mental health and substance use health, and that is really what the community is calling for.
Yeah, I can imagine that everyone is kind of waiting for this, and it must be, quite interesting work, to do as well.
Yes.
Once, I mean, you and I have experience in standards and accreditation. Once those guidelines are out, will there be ways to revisit and reinforce them, and to know whether or not what I'm using follows those guidelines?
Yes, so AI moves so fast that we don't wanna wait to be able to produce these guidelines because it is a phased approach over many years. But once we have information, we're really going to be doing knowledge exchange, ongoing. So we'll be at conferences, being able to communicate some of the research and the themes that we found. And there's really been three themes that we have found in the research. So we have identified about 10 considerations that map onto three themes with AI guidance for mental health and substance use health. And the first theme is around trust and explainability. So, Mental Health Research Canada recently published a report on some polling that they did that indicated that people are finding AI tools effective for their mental health, but only 12% trust them.
Mhm.
And this also speaks to trust around explainability in the decision making process for AI tools. So, picture that you are a practitioner and you receive an AI enabled alert on your phone for a person that you're supporting, and they're a high risk person. And whenever you go to look at how those decision points led to that decision, you can't understand what the process was for those decision points. So that's a problem. We need AI tools that can explain their thought process so that we can increase trust. And then the second theme that we found was around a human-centered approach to technology.
Mhm.
And this is probably one of the items I hear most often when in talking to folks, is around AI tools kind of being cold, and not the same as an in-person service. So we want to make sure that people are at the heart of AI tools.
Mhm.
And part of this is also, transparency around the if it is a chatbot, that we know that it's a chatbot and not a real person. So, being really transparent so that people are able to, not develop relationships with chatbots, not be influenced too much by a chatbot if it is, not safe as well. And then also around a human-centered approach to technology, it's also around, data and use.
Mhm.
So, mental health data is really complex, and this is part of the reason why we need AI guidance. So, think about a person if they're having in a crisis, and then they consent to their AI data being monitored. But then, whenever they feel more stable, they decide that they do not want that data in the system anymore,
Mhm.
and they change their mind. It's really hard to be able to retract that data at that point, and mental health data is very sensitive and stigmatizing, which further complicates the matter. And then the last theme that we found was around bias and equity. And this is also a theme that appeared in the mental health strategy for Canada. And we know that Canada has a very diverse population,
Mhm.
and we need to make sure that tools are safe and minimize bias for this diversity.
Mhm.
So, for an example, picture there is an AI tool that was developed for an Indigenous population, but the data that was used was for an urban audience that they had in mind. well, that tool for the Indigenous population is likely not going to be as relevant for that population, and it may not be as culturally safe. So we really do need strong AI tools to be able to minimize bias.
Wow, that's a lot. Thank you for that.
Of course.
It's really interesting research. And did you say that it's available or it will be available soon?
So at this point, what we're doing is we're developing a summary of this
Mhm,
information and looking to share that online through our website. But we're also sharing it through different conferences and speaking engagements, really to share knowledge at this point. And then our next steps with this work is we're going to be developing an advisory committee and a steering committee to really help us direct on if this is something that lands with folks or
mhm,
if these themes need to be modified further. And part of this steering committee will be people with lived and living experience who will be involved in this work. Similarly, to the e-mental health strategy for Canada, this is a really core element of what we do at the Commission.
mhm.
And the e-mental health strategy for Canada was actually half of the advisory committee population was people with lived and living experience. So we want to make sure that that is front and center as well with our artificial intelligence work, so that we really hear from folks, who are using the tools at the ground level. And then we'll always have our work available through our website as well for the Mental Health Commission of Canada and for the AI work with the Canadian Centre on Substance Use and Addiction as well. So we'll be sharing information with people that way at the same time.
Great. Thank you.
You're welcome.
I want to go back and pick up on a couple of things. I think from the data perspective, you mentioned how sensitive that data is, of course, as well, and how the choices might not always be in your hands, and you might not always know what you're consenting to when you use an app
Right.
as well, and who's going to be using that data as a secondary or third, tertiary user of that data as well. What are some of the other concerns around data, just to help people understand how important it is to consider that?
Yes. Well, you also brought up children.
Yes.
So that is something that we found, in our app assessment framework that we really want to strengthen around, consent and data with children. And, we know that sometimes as a parent, if you have an app that you're downloading and you see a policy that is about 12 pages long, are you really going to read every single part of that policy? And is it accessible to a child? So
Mhm.
think about, the language that you're using and is it in a format that children can understand? And sometimes whenever we are doing our assessment with apps, sometimes folks have a great app for mental health, but they just need to tweak, some of the language and the privacy policy and making sure that information is clear and transparent and in an easy digestible way. But with children as well, I mentioned about kind of retracting data. It's really interesting, if a child is using an app for mental health and their parent is kind of facilitating this if they're a young child. And then whenever they turn the age of an adult
Mhm.
and they decide, say, for example, they don't want their data in the app anymore, well, again, it's really difficult at that point to be able to change that and retract the data. So I mean, children who are utilizing apps, say with their parents, they might change their mind whatever they're reach the adult age and they might kind of want to do something different. And we need AI tools and mental health apps that are able to respond to that need.
It's a very complex kind of area that that will really need a lot of people to understand well, I think,
That's
and
right.
to really sort of stick to clear, understand the clarity of what's needed. So thank you for that. And the other thing is just in terms of, we mentioned access a little bit before as well.
Yes.
How big of a barrier, is access to these tools? If there are tools that become part of, a model, for instance,
Yes.
how big of a problem is it in Canada? Or is it, much more of a facilitator of, access than it is, than there are barriers?
Yeah, well, I think it's both,
Mhm,
really. So, I mean, I think what we hear from folks is they really appreciate e-mental health tools because, yeah, some of them are anonymous. They kind of appreciate that anonymity, sorry.
mhm,
And there's also a lot of stigma with accessing mental health services.
Mhm.
So sometimes having that anonymity or being able to access from, say, a mental health app or an AI tool, it provides that level of, anonymity that people would
Safety
like,
and
safety,
yeah,
yeah, to
yeah.
be able to access the service. So think if you are a new immigrant to Canada and you came from a country that really frowns on accessing mental health services. In some places it's punishable by law. So being able to feel safe accessing the services is so important. You probably wouldn't feel comfortable, walking into an in-person service, but you might feel comfortable accessing a peer support group, say, in a chat, or even, a therapeutic service via an online platform. We also heard, from the eating disorders community that they really gravitate towards e-mental health tools because again, they feel safer in an online environment than they might walking into an in-person service. And if they're reviewing food logs, they
Mhm.
don't, necessarily have somebody looking over their shoulder. They can do that in private as well.
Mhm.
And then I think there's so many, benefits for flexibility. So, we hear from folks having a crisis in the middle of the night. There's no in-person services available, but they are able to access a peer support group, say, for example, on an app. And we've heard that this has literally saved people's lives.
Wow, thank you. And then I guess we talked about, culturally, relevant, support,
Yes.
and what that looks like for for people out there who might be looking to, develop apps or programs, but particularly on the technology side, I think, who want to engage, with people and get the right guidance with respect to how to develop those culturally
Yes,
relevant
that's right.
supports. What would you recommend for them, in order to incorporate some of that lived experience and knowledge that we want to be part of the design?
Yes, absolutely. So, whenever we developed the app assessment framework, we did so over about 3 years, and we connected with about 200 Canadians, those living in Canada, as well as international folks. And one thing that we found with the Canadian population specifically is that they were really looking for more around cultural safety, social responsibility, and equity for an app. And this is not surprising, given the Canadian population. But it was such a strong theme that we decided to make it its own section
Mm,
of the app assessment framework. And this is something that was a bit new, to app assessment frameworks in the world. But I do know, like New Zealand was also doing something similar, given their Maori population. So, cultural safety in this app assessment framework, it really includes Indigenous data security and privacy
mhm,
because there is a long history of misuse in our country, unfortunately. So, we did want to make this section very robust. And we also included gender equity. So, is the app accessible to different genders? Also thinking about accessibility. So, is the app is it readable at a grade 5 level? Some of the text in the app. And it's so important to be able to think about cultural safety, especially if the population for your app is a population that is seeking gender or is seeking any kind of equity as well
mhm,
at the same time. So you can access our app assessment framework on our website. We've also turned our framework into an app assessment process. So we are actively working with apps that are interested in improving their app, and we're able to, in an online process and also back and forth process, being able to help improve apps in Canada. And those apps also go on our webpage. But we also have worked with the government of Newfoundland and Labrador to develop an app library. So that province actually has residents have access to apps that have been assessed on the MHCC framework with the cultural safety, peace, and mind, but also a list of other apps that have been assessed on the ORCA baseline review, which is ORCA is a company that we've worked with in the United Kingdom, and it's the Organization for the Review of Care and Health Apps, and they do a baseline assessment of apps for mental health and substance use health. And all those apps are also listed on the Newfoundland and Labrador page, and that can be accessed anywhere in Canada.
hmm. Really interesting. With all these assessment frameworks, again, going back to the point of, apps are changing all the time. And then so is that like a give me a sense of is that like a heavy process to go through, or is it a light process that is expected to be repeated throughout the evolution of
Yes.
an app or experience?
So it's not a pass or fail process, like some processes, which are also wonderful, where it's more the behind the scenes of pulling the information from the app, but it's more of a quality improvement process.
Mhm.
So we work directly with the app developer to help improve their app. Sometimes it's a matter of, like I said, tweaking the privacy policy. Sometimes it's a matter of thinking about how lived experience can be meaningfully part of the app development right through to the testing as well. And it lasts a couple of months.
Mhm.
And, by the end of that process, the apps have improved their app and we can ensure that they're safe and quality and effective for the Canadian public.
Amazing. Sounds like something that is helping, and has a lot of potential.
Yeah.
I'd like to talk about a few other, bright spots that you might wanna share in terms of zooming in on some things that, you're excited about because they're working or they have a lot of potential. So, maybe we could start with something about stepped care models and what that is.
Sure, yes. So the Mental Health Commission has partnered with different provinces and territories to implement a Stepped Care 2.0 approach. And this has been a partnership with Step Care Solutions. And in different provinces and territories, they were really looking for a way to be able to reduce wait times and be able to manage access to mental health services and substance use health services in their region. So this approach combines e-mental health and in-person care. So it's really kind of a combined approach, coming back to that flexibility in how people want to access services. And if you think about it as a ladder, so thinking about how people don't always require the higher levels of care on the ladder. So people might not always require in-person services, but they might benefit from also just accessing a mental health app or an e-mental health service rather than at that time in their life requiring kind of the higher levels, which also frees up the other access points in the system for accessing those in-person services. So think about it like there's a lineup for an in-person service, and say there's 40 people in the lineup, and then there's 20 people in the lineup that have access to an app or an e-mental health tool or an AI tool.
Mhm.
And then they leave the lineup, and that really frees up space for those, that actually need those higher levels of care as well. So it's really important just to have multiple access points in the system. And this approach has, drastically reduced wait times in some provinces and territories. So in the Northwest Territories, there is a 79% reduction in wait time in mental health services there. So it's really made a difference in these provinces and territories.
Amazing. It's such a great example of that simple idea that, technology can enable people to do the humans to do the things that, only humans can do
That's
or only
right.
humans are needed to do. So that's really interesting.
That's right.
Any other kind of spots that examples of things that are happening that you could share?
Yes, absolutely. So, I mean, just on the AI lens, I think, we often think of AI tools being used for therapeutic services for mental health, but we're really seeing a broad range of uses across Canada for AI tools for mental health. So they're being used also for triage, for predictive modeling, for system navigation, for electronic health records, really a broad range. A great example, coming back to the province of Newfoundland, they do have a website there, Bridge the Gap. And on that website, they have a chat bot that they call Bridget. So kind of bridge the gap, Bridget, you get
Nice.
it?
I like it.
And what they do with the chatbot is they use it for system navigation. And
Oh, wow.
they found
Makes
that
sense.
they've, been able to support
Mhm.
folks in Newfoundland to be able to access services, but at the same time, they've also gained so much information from the chatbot around what people are really looking for in the province. So it's a really great example. And they also use people with lived and living experience to develop the script for the chatbot and then also to review the script after. So they take a very evidence-informed approach, and they also identify that the chatbot is not a real person, so they're really transparent in this. And do not put your personal information in the chatbot. Do not put your family's personal information. So that is a transparency item that they're really leading the way in best practices.
Oh, excellent. That's great to hear.
Yes, thanks.
It's just I can't help but think it's funny how you're talking about how important it is to identify that it's not a person. So I was reading over an article about the tragic case of Adam Rain earlier this year,
Mm,
um, and how, something like identifying that is so important.
yes,
But in line with that, I was being served an ad about an AI, avatar that was, so human-like and build a relationship with it,
yes,
right? And it's
that's
it's
right.
just, the contrast of those two things, while
Yeah,
companies are continuing to try to make, AI more and more human-like, ensuring that there's a guardrail, is something that is so, important, but not necessarily something that everyone is striving for,
yes,
I guess. So it's a challenge. Um, and I guess at the end of the day, as a user, you're wondering, is it safe or not safe? And I
yes,
guess, there are still some gaps to look at
absolutely.
and things to understand, but that it's a work in progress. So I guess we can't assume that anything is safe necessarily right now.
Well, I think, we don't have a way at this time to assess if AI tools are safe for mental health and substance use care. So, we know we have an idea around best practices. And, this is evolving as we speak. But I think it will be really important to be able to really highlight, what we know and what's coming out of the research and what, lived experience can also guide us in this direction around what are the best practices for artificial intelligence. Because on the one hand, we have some incredible innovation for AI and mental health. And it's effective. We have people identifying that this is effective and supportive for them. But then on the other hand, we're also having some, really tragic cases and just, cases of misuse coming out. And we want to make sure that the tools that Canadians access are the top quality tools, and at the very least, that they won't cause harm. So that is where we come in with the AI guidance work.
Well, because people are using them and finding them effective today, we also don't wanna take them away, right? Because they're
Absolutely.
becoming
Yes.
part of the experience and part of the system already.
Exactly. Yeah, we don't wanna slow the progress. So we just
Mhm.
wanna make sure that they're safe and, reduce harm.
Hmm. What are some other things that you're excited about, as you look forward and continue to, consult and engage, and develop these guidelines?
Yes, well, I think there's just so much potential. I mean, we're seeing AI in everywhere in our everyday lives, so I think it, only makes sense that this window has opened up for mental health services. But I think, at the national level, we're seeing provinces really want to harness this potential of AI to be able to create efficiencies in the system. And on the triage side, we're seeing AI being used to be able to determine kind of the most high risk clients and be able to make sure that those people are able to be service first as well. We're seeing kind of AI being able to pick up cadence in people's voice to be able to determine a manic episode. So, extremely kind of broad ranges of ways that we're using artificial intelligence. Another way that we're seeing e-mental health being used is it doesn't have to be, in the higher intensity, like virtual reality, artificial intelligence realm. It could also be simply for, text reminders for
Mhm.
appointments. We're also seeing some work out of Dalhousie University where there's text reminders for your mental health and wellness if a person is going through a crisis. So this is a service that was made available, and during certain crisis situations, like during wildfires that have been happening all across Canada, people can sign up for these text reminders where they do get, daily support for mental health delivered right to their phone. And then if they need higher levels of support after that, it can help them find those higher levels of support that they need as well. So it doesn't necessarily, have to be so complex, the e-mental health or the AI service. It can also, come down to a simple service as well. Like, that may seem simple, but it's really making an impact as well.
Amazing. How about the whole idea of human in the loop? So I know, 6 months ago, I we did an episode here that was about, watching out for bias and inclusivity in AI, and is there any concern about using AI for triaging, as you mentioned?
Yes.
Is there still Are you still seeing a lot of human in the loop as we learn, what we can
Yes.
trust and not trust, and as we figure out what data is, strong and,
Yeah.
less strong in terms of what we wanna see for the future?
Yes, that is something that came out of our research as well on our AI guidance. So this was certainly it kind of speaks to that trust and explainability theme,
Mhm.
and making sure that there is some sort of connections with human oversight.
Mhm.
And I think this is especially true with suicidal ideation.
Yes.
So it's really critical that there is human support, and they're not left someone's not left alone with a device that cannot lead them to a higher level of support if that's what they need as well. We're also seeing, a lot of research come out around devices being really empathetic at the same time. So, in one research study, they were saying that there was an AI device that was more empathetic than an actual practitioner. And we love practitioners, so I would never want to, say that that was the case. But I guess, in this case, the AI device can really be programmed to make sure that you include those empathetic pieces. And I think that's also where the human oversight comes in, right? To be able to program these devices correctly. Not only, human oversight with a practitioner, which we really think is important for developing these tools,
Mhm.
but also with lived experience. So making sure that the end user is really incorporated into the development to really make it human centered and relevant as well for the end user.
Nice. I mean, like with anything these days, there's a lot of misinformation potentially out there, and there could be some misconceptions out there. And I guess I'm wondering, are there any misconceptions that you've come across that you might like to speak to at this point?
So I think, one thing I hear the most is that AI is all about robots. And I think robots is a part of it, definitely.
Mhm,
But, it's not the only part. So, stressing the fact that there is such wide range of use of these tools, not only for AI, but also for e-mental health. And that there are, even if it's not something that you personally might use, there are so many people that really depend on these tools and that really find so much support
mhm,
in these tools. So really just, wanted to stress the importance of being able to ensure that those tools are also effective at the same time.
mhm,
But I think, there's a common misperception that, whenever you think of AI, that you think of, the higher ends of tools. Like you see somebody in a virtual reality mask, those are all part of artificial intelligence and e-mental health. But we're also seeing it being used every day in other ways at the same time.
Well, it makes for
Opportunity.
good stock images on slides, I guess, when you think of it as
That's
robots.
right, that's right.
It's much easier to picture the complexity of, like, this, human, and machine interface,
That's
that we
right.
have with AI. So, no, I thank you for shedding light on that. I think
Of
that's
course,
important.
yes.
Um, and so, as we think about scaling innovation in Canada,
Yeah,
right? It is, easier when there are guidelines, although people might feel guidelines are restrictive or constraining. It can make things go faster as well. Um, as you see people innovating in Canada, both on like models and technology, and is there anything that you think we need to accelerate or ensure there's lots of? So, for example,
yeah,
around talent. So knowing, having
yeah,
the kinds of skills to, understand, risk or governance or AI
yeah,
or how to bring all of them together.
yeah.
Any opportunities there that you see to say, like, let's fill this gap or let's emphasize this if we really want to accelerate innovation in
Yes.
Canada?
Yes, absolutely. So these are really speaking to the priorities of the e-mental health strategy for Canada. And one is what you brought up around workforce.
Hmm.
So I think this really relates to the e-mental health strategy for Canada and the six priorities that we identified as important for advancing e-mental health in Canada. And you bring up the topic of workforce. And I think this is critical right now to our health population. and mental health population. But especially during COVID, we were seeing so many folks being asked to switch from in-person services to digital health services without any training or experience whatsoever. And we really do need implementation resources to be able to support these folks and proper training. And, that has continued, I think, with the onslaught of various opportunities to engage in digital opportunities. We really have to make sure that our workforce is trained in these areas and that they feel comfortable with artificial intelligence and e-mental health.
Really important. So, on the subject of workforce, I'd like to build on that, a little bit. And maybe this is something that, you've learned through your work with CAMH. But how can organizations and clinicians, prepare for, this change as, this adoption starts to rise further and the care experience starts to change more? What can they think about to prepare?
Yes, absolutely. So I think, looking at best practices and training resources. So the Mental Health Commission developed with CAMH training modules for e-mental health implementation because we were finding that, folks just weren't sure how to implement e-mental health properly. And just like in-person services, if it's not implemented properly, e-mental health is not going to work for you.
Such an important point.
It is. So I think that, making sure that folks are trained properly. And these e-modules that we developed are for e-mental health implementation. They're available on our website. They walk through different modules, so you can complete just one module, or you can complete the entire course and receive certification from the Canadian College of Health Leaders as well. So it's an accredited course. And thinking about, some ways that I mentioned, so incorporating those with living experience into your product, making sure that your workforce is trained as well, thinking about ways to be able to reduce bias whenever you're going to implement the mental health resource. Making sure that folks are ready to be able to work on an e-mental health resource. So, making sure there's some sort of readiness assessment that is completed. So, these are all components that are really important for successful e-mental health implementation.
I'm so glad that you guys are addressing that and looking at it. I think that there's probably a misconception that it's a mental health tool. It's online. It's digital. I just log in. Like what is so hard about that, right? But that to me contrasts the difference between an individual user's kind of experience versus an experience that needs to be integrated with an organization or with a care model or with
Absolutely.
a progression of support, across an ecosystem, and what happens with the data. There are so many things to think about as part of that adoption and implementation, as you put it. I think it's something that is probably underestimated in a lot of cases. And so, setting organizations up for success, setting clinicians and users up for success, is really important.
That's right.
Great. Are there any stories, Maureen, that, kind of inspire you, in particular, in this area, maybe with respect
Mhm.
to, giving you hope or seeing like the possibility of what's there?
Yes. Well, I always appreciate whenever a story is shared with me around, how the mental health or AI has really made a difference in their life. And there is one that has really stuck with me. It was around a young woman that really needed access to mental health services, but they didn't want to necessarily access in-person services. And, they have been in crisis as well during the nighttime when they really needed some support system around them. And they also needed a way to be able to talk with their family members around their mental health issue that they were experiencing. So they were able to access a support group on an app, really, at midnight, whenever there's nothing else open, and being able to talk with others that were experiencing similar issues. It really, like they said, saved their life. And it really speaks to the flexibility around these services, being able to, access whenever other items are closed, or maybe just there's a long wait for certain services. And that's really what we're trying to do is really increase access for people. And, sometimes this is also a preference, like people's preference to be able to access these services. And, we talked a bit about stigma. There is a lot of stigma, unfortunately, with walking into an in-person service. So some people, feel comfortable, more comfortable, and these stories really inspire me to be able to hear this.
So much impact there, Maureen. We can't schedule everything in our lives. And so I appreciate that in terms of the flexibility. Thanks for sharing that.
Of course.
I guess the last question I have is just, for people who want to engage and be part of helping to build that, safe, experience for the future of, people here in Canada and maybe, how we influence like people internationally as well. I know you're going to a conference soon where, many countries will be presenting in terms of where they're at, sharing knowledge
Yes,
and
that's right.
collaborating. But how can sort of the average person, contribute or help to promote awareness and participate in this conversation?
Yes, well, it's a wonderful question, and I'm so glad that, folks do want to get involved. And sometimes it's also about, educating yourselves around, what you can do to be able to support yourself, support your family. So we really do encourage folks to be able to access our resources, also connect, with your local healthcare providers to kind of, see what's available in your local region to be able to do that. And we do also have ways to engage with our artificial intelligence guidance work. So we're going to do a call out coming soon for folks that might want to, stay engaged, stay up to date about what is coming. And we do also have our youth council and our hallway group. We actually just finished recruitment for our youth council,
Oh, amazing.
but we do have opportunities as well. If you do have lived experience, to be able to engage that way, so that we can make sure that lived experience is part of the conversation.
So about social media use and the connection with e-mental health, what's the approach or guidance with respect to social media use and how has that evolved over time?
Yes, so it certainly is a topic that is of importance that we're hearing a lot about, especially with children and youth. So a recent report also identified that 90% of youth in Canada are engaging with artificial intelligence, and we know that social media is also a big part of that. So we know that it's integrated into our everyday lives. A few years back, I think we were most worried about people's screen time, and we still are, worried about
Yeah,
people's screen time.
I am.
But I think these worries have now evolved to deep fakes, online manipulation. We also have a lot of AI generated images.
Mhm.
I don't know, whenever you were growing up, did you ever look at 17 magazine? I
I
know I
did,
did.
yeah.
And you saw that beautiful picture on the front cover
Mhm.
of that person, knowing, very much in the back of your mind, though, that that image has been highly edited. Now, this is what we're seeing with artificial intelligence images, and young people really seeing these images as a perfection of beauty.
Yeah,
So, there's so many items that are coming across for artificial intelligence and social media use. I'm not saying that there isn't so many good things that are happening, with social media and children. Like there's so many ways that they can be connected and learn as well. But we're also seeing some effects that are more negative as well on the social media side. So
yeah.
we're actually going to be working with the Knowledge Institute at CHEO, the Children's Hospital of Eastern Ontario, to develop a resource around both the positive and the negative effects of social media for young people and mental health as well. So you can look for that resource. And CHEO also published some additional resources around social media use with children and youth, and you can find those on their website.
Excellent. I love that you're looking at both sides of that as well. It's important to take a holistic approach and
Yes,
to look at it very openly. So
that's right.
that sounds exciting as well.
Yes,
Great to see that.
thank you.
We will have to have you back for another podcast to talk about that.
Absolutely.
Thank you so much, Maureen. That's exciting. Great. Well, I hope, we can have you back again to share more research or insights with us. I wish you the very best and grateful to you and your team for all the work that you're doing and across Canada to others who are working in this space as well. I know there are a lot of people who are thinking about data and AI and experiences right now and thinking about guidelines. And so I'm so happy to be part of the conversation. If you're interested in this topic or others that are related to change and transformation, how they impact us as humans, I'd encourage you to subscribe to Wired for Change. Thanks so much for listening, and that's another episode of Wired for Change.